Domestic violence services are in crisis. Why? Well, the Chancellor is in control of the budget. Every year, the Chancellor gives a certain amount of money to the Department for Communities and Local Government, the Local Government Central Grant. The Department for Communities and Local Government then shares this money between the 217 local councils across the UK. This grant has halved between 2010 and 2015 and is planned to be cut by a further 30% by 2020. As the local government central grant reduces, so does the amount that each local council gets. Councils use this money to fund all the things that people in their area need, such as children's centres, libraries, roads, rubbish collection, care for older people, and domestic violence services. Their ever-decreasing funding to do all this means that councils are having to make cuts. Some domestic violence services have simply been cut and closed their doors. 2 in 3 survivors who approach a refuge for help are now being turned away. How can they flee when there is nowhere to go? This puts lives at risk. So how do councils decide who will run domestic violence services? Competitive tendering is the process through which councils advertise contracts to run domestic violence services for different organisations to bid for. Councils looking to save money will choose the organisation offering the lowest cost, not the highest quality. This process automatically disadvantages small specialist charities who cannot compete on cost. Large organisations without specialist expertise are far more likely to win. When they cannot win contracts, smaller charities are forced to close. This means that decades of expertise and experience are lost. At least 34 specialist refuges have been forced to close since 2010. Other councils are renegotiating contracts. This means services are expected to provide more for less. If the service refuses, then they are likely to lose that contract. Staff are employed on short-term contracts and on ever lower salaries. A service might be expected to support the same number of survivors, but with 4 members of staff instead of 5. Services are forced to spend time, money, and energy on competing against each other instead of focusing on their life-saving work. Domestic violence services are only being funded on a short-term basis and are under constant threat of closure. Services are now fighting for their own survival instead of the survival of those that they support. Services are able to offer less support as staffing and resources have been stripped back. As a result, LGBTQ, BME, and disabled survivors, those with mental health problems or who use drugs and alcohol, those who do not have UK citizenship, and those who don't speak English, face many more barriers to accessing support. For example, 4 in 5 BME survivors who approach refuges for help are now being turned away. As you can see, the way that services are being cut is complicated, but this is the result. Domestic violence services are in crisis. This is a matter of life or death. We are Sisters Uncut, and these are our demands. Stop cuts to domestic violence services. Restore funding that has been cut. Provide long-term, secure funding. The government must protect funding at a national level, and local councils must fully meet the needs of all survivors.